Welcome to the Optimity Advisors Integrated Care webinars. My name is Micol Tedeschi, and today I will present the second episode of this series. So, what will we cover today? Following the first episode on the key benefits of integrated care, today I want to speak about why the context in which integrated care is implemented is so important, and how different contexts can actually influence the success of integrated care initiatives. When people speak about integrated care systems, they often refer to it as a goal. But having an integrated care system is not the end result. It is a process in which different elements of a care system work together to improve the experience of people receiving care. And this becomes even clearer when we look at different countries. In our study for the European Commission on Integrated Care, we reviewed integrated care initiatives in the 28 European Union member states, plus Norway and Iceland. And we found that integrated care has been implemented in all 30 countries in very different ways. The goal, however, of all of these over 550 integrated care initiatives was the same, which is to deliver the best possible health and well-being outcomes, improving patients' experiences, reducing costs, and making care provision more efficient. In this webinar, I will compare different countries in Europe to show how there is not one right way to do integrated care. So, how do different countries in Europe implement integrated care? Today, we will cover some of the key elements of a country's context which influence how integrated care is implemented. The first element that I will cover is the length of implementation of integrated care. Today, all countries across Europe have integrated care initiatives, but as it is expected, different countries have initiated their journeys towards integrated care at different times, and this variation in the length of adoption of this process is significant. Let's look at the UK, for example. The UK is one of the early adopters of integrated care models. It has started to work towards achieving closer integration of health and social care since the early 70s, and its commitment has only become stronger and stronger. An example of this is a recently published 10-year term plan, which has a strong focus on the development of integrated care systems across England. So, in the UK's case, the length of the implementation of integrated care has clearly led to a very high maturity of care integration across the country. But let's look at Bulgaria. The expression integration of health and social care was only introduced in 2015, and the implementation of integrated care is still at its early stages. However, this is not always the case. In Belgium, for example, integrated care models only started being implemented in 2008 with the Priority to Chronic Diseases National Plan. However, according to the analysis from the Scirocco tool, which is a tool that measures the maturity of integrated care systems, and we will cover this tool in more detail in webinar number 4, Belgium scored very high in terms of maturity. This is important to show that although the length of time is an important factor for the maturity of an integrated care system, it does not necessarily affect it. Many more factors need to be taken in consideration to assess a system's maturity. An example of such is the political support for the development of integrated care. Initiatives across Europe show that clear policies and strategies showing political commitment are important enablers for the development of integrated care systems, both at regional level and at national level. Spain is a perfect example of consistent political support. Healthcare in Spain is provided, regulated, and financed at regional level, and the Basque Country is the most advanced region in terms of its integrated care. This is due to the consistent commitment and whole system policy approach that the Basque Country has taken, which made the transformation of healthcare to an integrated care model as a priority. Poland, on the other hand, is an example of a country where health policies are made at national level, as it occurs in most Eastern European countries. The Polish strategy documents focus on clinical integration of care between primary, secondary, and tertiary care, leaving out the integration of social and healthcare services. Although the maturity of integrated care systems is low, the strong political support at national level is contributing to the development of an integrated care system. The third element that I will cover is the healthcare system composition. Healthcare systems can plan, manage, fund, and deliver care at local level, at regional level, and at national level. This is also reflected in the type of integrated care systems that each country has. Examples of countries delivering care at national level are Iceland and Greece, where healthcare is centralized at national level. The centralized healthcare system leads to integrated care initiatives aiming at transforming the system as a whole. An example of healthcare system that functions at regional level is Italy. The 21 Italian regions are responsible for the organization, provision, and governance of the healthcare system. Therefore, in Italy, there are a wide range and variety of regional level initiatives, and this can lead to different levels of maturity across a single country. In Italy, for example, the Lombardy region has made the greatest progress in developing policies that are specifically aimed at integrated care implementation. Finally, an example of healthcare system operating at local level is Sweden. Sweden has 290 municipalities. One example of Swedish integrated care initiative is the local healthcare initiative, which is a community-oriented primary care system supported by adaptable hospital services, and importantly, they fit the needs of the local population. Another important element that can affect the way integrated care initiatives work is the way they are financed. Like any other transformation plans, the development of integrated care systems require initial investments, as well as operational funding, and as expected, different countries finance their integrated care systems in different ways. So let's look at the Netherlands. The Netherlands introduced an integrated payment system in 2010, and this has been perceived as the key factor that enabled the development of a well-functioning integrated chronic care system. In Denmark, on the other hand, funding schemes are co-developed between the 5 regions and central government, and for the past 20 years, Denmark had a secured budget for integrated care established at national level. Finally, the last essential element that characterizes integrated care systems around the world is its collaborative nature. The idea that when people from different levels of experience, specialty, and professions work together, the highest quality of care can be provided. All Nordic countries are a great example of the development of their workforce into multidisciplinary teams. Let's have a look at Finland, for example. Since the 1970s, it has focused on a primary care system based on health and wellness centers, which are run and funded by the local authorities. Moreover, the Finnish Exote project has been a key example with its multidisciplinary wellness centers offering integrated care. They employ a large number of staff with different professional backgrounds, including social and community workers, as well as psychologists, nurses, and clinicians. To conclude, I hope that from this webinar, you will take home the message that there isn't one single way to do integrated care right. There are a number of contextual factors, such as the length of the process, supporting and committed policies and strategies, healthcare system composition, financing mechanisms, and the workforce composition, among others, that influence the shape that the integrated care system will have in a certain country. But what is sure is that whatever the way integrated care is delivered, it is a necessary process that is taking place in healthcare systems all over around the world. Thank you for listening and see you in the next webinar.